Anna, this is so important to talk about. I am so glad you left this comment. You write, I worry, however, as a nurse, knowing the body is built around the tongue. You basically have to let your body relearn after that. 100% truth. That's why myofunctional therapy is so unbelievably important. I think I'm hearing so many people say that they're like, oh, you don't need to do myofunctional therapy. You just have to cut it and then you're done. I don't believe that. I believe that may be the case and probably is the case for newborns. So let me clarify, for newborns, for little babies, but as you become an adult or an adolescent, I'm 54. And so I've had 54 years of a type of speech pattern, the way I use my jaw, the way I chew, all of this in here, the way I speak, how I use my tongue, all of it. And I have to relearn when they release the tongue tie. I'm like, right now in my therapy, I'm strengthening the jaw. I mean, there's parts of my mouth that are very underused because when we did all of my assessment with the myofunctional therapy, I was overcompensating, which is what we do when we have issues. Our body will always try to overcompensate. So I'm having to relearn, because if not, here's the issue. If you don't do that therapy, especially as an adult, you run a high risk of having speech issues, a lisp. There's a whole host of breathing issues, all sort of things you've got to relearn and retrain. So it is really invaluable to do that. And so if you were to go to a doctor, if it were me, if I were going in and they're like, yeah, I can just take care of that right now, and they don't suggest that you have therapy or strongly say like this is part of the process, I don't know that I would go to that doctor. That's just my personal opinion, but I just believe that you don't want the risk. I've heard so many positive results, but I've also heard people say that they've had nerve damage or loss of sensation. There's a lot that's connected to the tongue. So you want to make sure, not only are you going to a doctor that knows, does tongue ties, you want to make sure that you go to a doctor that does a lot of tongue ties, not like 1 or 2 a month or a few a year or even, 5 a month. You want someone that does this kind of on the regular. And not just on babies, but like for me, as an example, my myofunctional therapist is saying, I've got my doctor that I was recommended here in Vegas, who was, highly recommended, and she does a lot of babies. And she was actually trained by this doctor, her technique in LA. But there's this other doctor that is in LA who we're kind of leaning, she thinks because my mouth, my tongue tie issues, I have multiple in there. She thinks it's a little more challenging. And so we're going to kind of go along a little bit more, but she's kind of leaning to me to go there just because he does so many tongue ties. He not only does babies, he does a lot of adults. And not to say the gal here isn't great, but I just know I want someone who is at the top of their game when they're dealing with this. And he also is one of those, like, you have to work with your myofunctional therapy before and after, before he will take you on as a patient. And I think that that's the most important thing. Don't just think you can just cut it and be done. Like I said, if you're, as a baby, yes, it's amazing. That's when you want this process. But I'm talking about adults, adolescent, as you get older and you develop those speech patterns, you've developed a way of being your whole body structure. It needs to be relearned. And yes, I'm a huge fan of myofunctional therapy. And I've also heard a few horror stories that these doctors, here's an example. One of my myofunctional therapist patients, he went in to get wisdom teeth done with a dentist, and then they're looking around and they're doing the work, and they're like, oh yeah, you know what? You have a tongue tie. Let's cut that right now. And so he just cut it, and like no thought. It was like a butcher. Like literally, she said it was so cut up. It was so poorly done. And then he had a lot of issues. He's now working with her trying to undo the damage of the speech stuff that happened. But like that is an example of like irresponsible at the highest degree. So don't think, and I understand that myofunctional therapy isn't cheap, but I do know, and I'm working on getting some resources for you guys. I know that there are quite a few people that do the therapy sessions online, which I think is an awesome idea. I wanted to have my first session in person just because I just like that in-person feeling. But to be honest, I can see where the functional therapy, for the most part, could really lend itself to beautifully online. And I think when it's online, perhaps you might have an opportunity to get a more reasonable rate. And obviously, you still want someone that's qualified, that has been doing it for some time. But there's a lot of options out there. But if we're going to do this is our mouth. This is our everything. We want a great result. And the great result means that you look at the whole picture, not the, the 1 minute of the procedure to get it done. It's the aftercare. It's we want to go in as strong as we can, and we want the best result. And that is going to be with really doing the exercises. And yeah, is it a pain in the butt? Yeah, the exercises are kind of a pain in the butt. In fact, I'm due for my second time around today. But you know what? I noticed, look, I talked about this the other day. Look at my jaw. Oh my goodness. It really is lifting. It's lifting and firming and toning. That's another reason. You're going to have better result from your tongue tie, and you're going to have a better face. You are going to look 10 years younger or more. So I can't recall if I gave you the resource in this video. I know I have in another video. Anyway, it's called the Breath Institute. That's the doctor that I'm considering going to in LA. He is incredible, a doctor. His wife's a dentist, and he does all things with tongue ties, with breath work, all different kind of oral issues. He specializes in it. He seems so kind. He's got the sweetest little baby boy that's, maybe he's like 3, that had the tongue tie. Anyway, he's a wealth of information, so I think it's a great resource for anyone that says, I think I might have a tongue tie, or know someone, and just to get some more information. So I'm curious, Anna, did you know about tongue tie and what all the external issues that can go to a tongue tie that are related? I'm curious if that was something that you were ever taught. Yes, we understand like the tongue tie, that the obvious, that people have a lisp, but no one really thinks about all the other things. So I'm curious, did you know, was this on your radar before my video? Update. I've been doing my exercises. My next appointment in person with my myofunctional therapist is on November 30th. That will be 2 weeks. And I finished my sleep ring. I did my sleep ring for my at-home sleep test. I finished that on Saturday, so that just got shipped off today. So hopefully I'll get back all the results from sleeping. But I have to tell you, wearing this sleep ring, this is my Oura ring, and it's fabulous. But the sleep ring, it's like this kind of big, and it's a little bit clunkier. I had the crappiest sleep. So I'm telling you, I think I got one night of like the 6 or 7 nights that we tested my sleep. I think I got one night that was good, but the whole time I'm just like, I'm thinking about that ring. I'm like waking up and I sleep like this, and I had like a big ring mark on my face. It was not fun. I don't know. Hopefully my lack of sleep doesn't give me false results on the sleep test, but anyway, that's part of the process. So I will keep you posted, and thank you for listening to my tongue tie journey. Okay, bye.